tune it in the sun. This is TFM. Get ready to rock. From AM to PM. Come on. Let's talk.
TFM 95.4.
Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to the Midday Update. These are the top headlines from our newsroom today. No hospital admissions seen among vaccinated people in Oman. No upper limit on remitting money from the Sultanate. New 5-year plan for health development in Oman launched. Royal Oman Police seeks help to find missing citizen. UK to immunize adults first before sharing COVID-19 vaccines with other countries. Morocco suspends air traffic with France, Spain over COVID-19. Oman sailed to host Olympic qualifiers for the first time in the Sultanate. In addition to that, we'll be joined by Dr. Ahmed Al Busaidi, who is going to tell us a little in detail about the new national program for organ transplant that has been established in the Sultanate. But before that, let's see how the weather looks like in the Sultanate in our weather update.
This is Mayth Al-Shikeli with today's weather update. And at the moment, I'm standing outside the TFM studio in Al Khuwair. Before we move on to weather, here is our fact for the day. The term 100-year flood doesn't actually mean that a flood happens once in 100 years. It actually means that a flood has 1% chance of happening within a single year. That is our fact for the day. Now join me inside the studio and we'll move on to weather. An alert has been issued by Oman Meteorology and Civil Aviation Authorities saying that there will be poor visibility due to dust rising winds and fog formation. There will be mainly clear skies in the Sultanate with chances of late night to early morning, low-level clouds or fog patches over the parts of South Al-Sharqiyya, Al-Wusta and Al-Dhahira. And now let's take a look at how the weather will be like in all the governorates. Muscat will be sunny, temperatures between 37 to 28 degrees Celsius. Musandam will be sunny, temperatures between 34 to 24 degrees Celsius. North Al-Batana will be sunny, temperatures between 31 to 25 degrees Celsius. South Al-Batana will be sunny, temperatures between 37 to 29 degrees Celsius. Al-Buraymi will be sunny, temperatures between 38 to 24 degrees Celsius. Al-Dhahira will be sunny, temperatures between 41 to 22 degrees Celsius. Al-Dakhiliya will be sunny, temperatures between 40 to 27 degrees Celsius. North Al-Sharqiyya will be sunny, temperatures between 40 to 25 degrees Celsius. South Al-Sharqiyya will be sunny, temperatures between 38 to 26 degrees Celsius. Al-Wusta will be sunny, temperatures between 41 to 24 degrees Celsius. And the Far will also be sunny, temperatures between 35 to 22 degrees Celsius.
Welcome back to TTV. You're watching Midday Update. Now, before we get into details of the local stories for the day, let's see how the COVID-19 situation looks like in Sultanate today. The Ministry of Health has announced the registration of 7 death cases due to coronavirus in Oman today. This has taken the total death toll in the Sultanate to 1,669. The health officials have also extended their deepest condolences to the families of the deceased. Moreover, the Ministry of Health has also registered 1,173 new coronavirus cases in Oman today. The total cases in the country have now touched 158,056, including 143,398 recoveries and 1,669 deaths. Now, according to the health officials, in the past 24 hours, 454 recoveries were also reported. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. And now from a local desk. As you all remember that last week, the Minister of Health in the country issued a ministerial decision to establish a national program to organize the transfer and transplantation of human organs and tissues. And I mentioned earlier today that we'll be having Dr. Ahmed Al Busaidi joining us, who is also the member of Technical Committee for Organ Transplantation, to talk in detail about this national program. So let's welcome him to the show. Thank you so much, Dr. Ahmed, for joining us today.
Thank you very much, Madiha, for having me.
So first, I would really like to congratulate you on this national program that has been established in the Sultanate. Could you please tell a little in detail about this program?
Thank you very much again. And this program, actually, it is not new. It was since early 1990s. It was a venture between Royal Hospital and SQH. And through which this program, we managed to transplant around 300 kidneys. And recently in 2017 also, we started doing liver transplant, and we transplanted around 11 cases. So it was, joined in hospitals, but of the increased demand, and in order to improve the facilities and to make it more organized and more structured, and at the national level, the Ministry of Health issued this qarar, lifting up the program to a national level and to have an Ministry of Health headquarters to manage, coordinate, and liaise with others for the issue of organ transplantation.
Dr. Ahmed, I would really be interested in knowing what exactly is going to be the way forward considering this new national program. How are you planning, or how is the program team planning to create or raise awareness about this transplantation in the Sultanate?
Now we have around 3,000 patients who are on dialysis, and with an annual of 200 to 300 new cases per year. So these people are living on dialysis, which is not easy. It's a difficult life. And the only way to improve their life and save their lives is transplanting another kidney. And the only way to get organs in case of organs failure is only from human being. We cannot create them or manufacture them. It's the only way is to have it from people. And having organs from people can be either for dual organs like the kidney. They can donate during their life safely with one of their kidneys. And the same thing with the liver. Also, they can donate part of that, which can also regrow later on. So during life, we have this chance for people failure and kidney failure. For heart failure and lung failure, the only organs is only through the deceased donor. It's something not common here, and people need to be educated and well informed about this option. Once human being diagnosed with death, the only option will be to bury the body with all organs that going to dissolve within few days, or use some of these organs to save the life of other people.
Dr. Ahmed, I was just going to ask you, when you mentioned the number of about 200 to 300 cases every year you're receiving, and what are the most highly demanded category? Is it the liver? Is it the lung? Is it the heart? And you said that liver and lungs can only be transplanted once the person is deceased and has mentioned that he would like to transfer his organs. What about the 200 and 300 cases, doctor, every year that you're receiving? What exactly are these categories for? Is it for the liver? Is it for the kidney? What exactly is this for?
This one for kidneys. For the liver now, we are on a comprehensive registry to register all cases, including liver, heart, and lung. But at present, we have a registry for and the number that I told you only for the kidney. So we have 3,000 people on dialysis. We almost get 200 every year new cases. So the kidney and liver during life, but disease for heart and lung, it's only from disease. Not take the heart or a lung from somebody who is living.
Dr. Ahmed, in your opinion, you are in this field and you're the expert. Do you think this 3,000 number that you have mentioned about people on dialysis is a concern, or is it a worrying number? Is this something that you want to tell people about, that 3,000 is increasing, or anything like about this number? How do you see this number?
It's I mean, within the international categories and with international incidents, it's almost around one per million population. So we are around 4 to 5 million. So it's within range. But I mean, what I need to tell people is first to work on prevention. So like controlling your diabetes, controlling your hypertension, providing being overweight or obese, because these all are risk factors, smoking also, and like physical inactivity. In addition to genetics factors that also mainly in children. So in case you have taken all precautions and then you developed an organ failure, we will come to also, it's not the end of the life. We will come, the program will come at this, where we will try to find a suitable donor, whether it's a living, one of your relatives, or a diseased donor if there is a diseased donor. So for that, we would like to, encourage the community actually to donate for the family member during life for kidney and liver, and also express their will about how they want their organs after this. Do they want to bury them and become like a soil after 2 days or 3 days, or do them to be in a child who is actually suffering and almost losing his life, to have a new life and grow in this life. And just to tell you, Madiha, in early 1990s in Oman, it was transplanted that time the youngest. Any boy was transplanted from a youngest diseased donor. It was a European baby born to a European family here with brain death. There is something major missing in her brain, so she was diagnosed with brain death. We came forward themselves and asked for organs to be donated actually. And it was her kidneys was transplanted. 17 months old Omani boy who managed actually to live a normal childhood, and then he joined a college. And you can see the impact of that decision of that family to this child, almost his life. He got a new life. He lived his childhood. He joined school. He joined college, and he's still alive.
Dr. Ahmed, that story just brought a big smile on my face right now, that how, like a small baby could be a part of something that big. Do you think people actually are well informed and educated about how these transplant actually saves lives? Or are they a bit fearful, when it comes to, of course, when you're in that position, when you have a deceased person, like a lot of people are reluctant to actually transplant the organs of the deceased. Do you think that happens here too?
For the living, we come actually for donation, but because of increasing number of non-communicable disease, it's very hard a living donor. People, they come, for example, we have some 5, 6, 7 people, they will come from family for checkup. And then something will pop up, like undiagnosed diabetes, undiagnosed overweight, or some mild kidney impairment. And for living, nobody will be allowed to go for donation unless he passed all the meticulous clinical evaluation and laboratory evaluation. So if there is any small risk for that donor, he will not be allowed actually to go for the donation. Now for diseased, we have a couple of cases from diseased donor. They were from non-Omani, and but from Omani, we hope inshallah we are working on a campaign to educate the public about the importance of expressing their will after. So if we get somebody who actually expressed their will and informed the family, and family agreed, then the system is there for the transplantation.
Dr. Ahmed, we have a question from one of our viewers asking, how do you become a donor? Is it necessary that you have to be within the family circle, or can you be a complete stranger and want to donate one of your organs while you're alive or after you are dead?
While you're alive, it is allowed up to the stages. Fourth degree relative. For non-related, it is also allowed, but the technical committee has to approve. So why we need to the technical committee? Because we want to make sure that there is no financial gain, direct gain or deal between the donor and recipient. And you know that organ trafficking is prohibited by the international laws and local law, and by the religious, by the ethical guidelines. It's prohibited to have of organ trafficking. So if is there any deal or any exchange against an organ, it is totally prohibited, it is unethical, and it is illegal. So in case unrelated, the committee ensure that there is no such thing. And people, they do donate for their non-relatives, for example, friends. They do donate also for their friends, and so sometimes school teacher, sometimes also, in other words, they donated for their students, because they know them, they become like one of their family. So when they get to know that the student having like a kidney failure and there is no donor, they go forward and donate for them. So this is the way now for the living. For the deceased donor, now currently there is a card in Royal Hospital that needs to be filled, but that one we felt it is very difficult, especially during COVID, for people to go and fill the card. So for that we are working for an online platform in order for people to express their will. So the inshallah platform, we hope it will be released soon, so people they can express their will. But what is more important than filling the card or putting it online is discussing with the family. Because even if I donated my organs, then my family object will not go forward. So informing the family is the major stake here. Discuss your family, educate them, tell them about your wish, about your will. So even if you don't fill the card, then put it online. But forbid you were diagnosed as dead, and their family, they forward telling that you had a wish and to execute your wish, then the donation will go forward.
Dr. Ahmed, that was exactly my next question to you, that in your career, have you seen that people have actually, written down a will or have expressed their wish that they would like to donate their organs once they are deceased? And is there any problem, like even if the will is there and you said the family objection is there, how does it contradict?
So yeah, there are people actually who express their will for donation after death. And also, as I mentioned, that we are making it for them easy by having the online platform, and we expect many people to come forward because of level of education is improving. And I'm sure that, it is difficult for them, especially to go from far away to fill this card. For that, when we will get the online, I think it will be easy for us. So it should be done in a mutual way, because this is a donation. I cannot to you, Medih, and ask you, please donate for me 10 riyal or 5 riyal, even if I know that you can do that one. So it should be done with a mutual agreement. The person himself expressed that he would like to go for the donation. The family also, they should for that donation. And internationally, there are two systems, one called opt-in system and opt-out system. So the opt-in is people, they go and sign up for their donation. But opt-out system, which is many of the European countries, all people are considered by default as a donor. So if you reach 18, then you need to sign up to donate. So for that, the mainly in Spain, it's one of the highest for disease donor because of this opt-out system. But at present, we are going for an opt-in system that we hope, inshallah, it will work also.
Dr. Ahmed, what happens in the case that there is no will or consent from the deceased person, and that time a family member decides, that this organ or certain organ of the deceased person can actually save a life of someone who's fighting death in the next room? How does that work? Is this legally allowed here, or do you still need the consent from the person whose organs are to be donated, while of course he or she is alive?
According to the law issued in 2018 that regulate the organ transplantation, it is allowed if the family, but it is written as an exception. So the default is for him to express his will and to consent. But in case the family consented, it is also allowed.
Right. Dr. Ahmed, we have another question your way, please. One of the viewers asking, up to what age can you be a donor? So what exactly is the starting?
Above.
18 and above. Okay. Okay, any other piece of advice or information that you would like to share with our viewers, Doctor, on this amazing and this incredible initiative that has been established in the Sultanate lately?
First of all, the duty of health is to prevent disease. So prevention. So let's educate ourselves about what causes kidney failure, what causes liver failure, what causes heart failure, and try to prevent. So this is the first line. So in case this one didn't work for any reason, and people they get organ failures, then we need our solidarity as a community, that we will not let these people die in front of us. We will come forward to do whatever can be donated, like the kidney or part of the liver or the bone marrow, or we will express our will that get our organs after this. So speak to your family, educate them this very important concept, and just tell them that in case, God forbid, you found to be a potential donor, to object, because this is a noble deal. This is like, it will be sadaqah for you for rest of your life. It is ethical, it is legal, it is a life-saving people, and there are now people among us who are actually living because of sacrifice of others.
Thank you so much, Dr. Ahmed, for sharing such a wonderful piece of advice and for telling in detail about the national program and how people should educate themselves, how they should mentally prepare if they are willing to donate during their lifetime and once they are not with us. So thank you once again for your time. I hope that we all have learned something from you today. Thank you once again for joining us.
Thank you for this interview, and I hope, inshallah, we can in future have another one for more detail about the program.
Thank you so much, Dr. Ahmed, once again. Well, that was Dr. Ahmed joining us today. We will continue with the rest of the local stories for the day. None of the people in Oman who have been administered the COVID-19 vaccine have been admitted to hospital for the disease, a specialist on national infectious disease at the Royal Hospital has said. There are no cases we have seen of patients who have been admitted to hospital after receiving the vaccine, said Dr. Zakaria bin Yahya Al Balushi, consultant of infection and infectious diseases at the hospital. He added, however, that the sharp increase in the numbers of COVID infections in the country proves that Oman has entered a new wave of the virus. He revealed that the numbers of people admitted to intensive care because of COVID-19 reflect an alarming and disturbing increase. Previously, the number of patients we had here in intensive care did not exceed 10, but it is now at 18 cases. This indicates we have entered a new wave. The doctor also warned people who had previously been infected with the coronavirus to not take lightly the precautions that need to be followed to stop the spread of the disease, as there have been incidents of patients being admitted to hospital after being reinfected a few months later. Now, expatriates living in the Sultanate of Oman who wish to remit money to their families back home can send as much as they wish to, as there is no limit on the amount they can transfer. According to Ahmed, the general manager of Global Money Exchange LLC, an exchange house in the country, people who remit money above a certain limit, though, do need to provide proof of how they come by those funds. He said that in terms of remittances, anyone can remit any amount of money at any time. Each organization has its own limits on how much money you can freely remit based on its anti-money laundering protocols. You can safely remit about 5,000 to 6,000 Omani riyals at a time, but any amount above that will require you to provide additional details. He said that if you do need to send more money than that, you need to provide a bank statement which shows you have the money in your account. There is no ceiling, but whenever it goes beyond this threshold limit, you need to be prepared to provide these additional documents. They need to ensure the source of that fund. While there is a list of documents remittance companies use to verify that the fund remitted actually belongs to the person remitting them, the exact paperwork required might differ from one organization to another. He said that an additional document that you might be required to provide if you're remitting this money on behalf of a company is a copy of the commercial registration. If your statements do not match, the institution may decline to complete the transaction. People who do remit money above a certain limit can also expect to face questions such as relationship they have with the recipient of the funds. The Ministry of Health has launched the 10th five-year plan for the health development 2021 to 2025, which aims to achieve the strategic objectives of health priority in Oman Vision 2040. A statement issued online by Oman News Agency said the plan is based on a number of pillars, the most important of which is Oman Vision 2040 and the Health Vision 2050 and the Sustainable Development Goals and WHO Program of Action and the UN General Assembly Political Declaration on the Prevention and Control of Non-Communicable Diseases. The statement added that the plan includes 5 strategic objectives, basic priority initiatives, and 43 expected results in which the ministry will participate, including the central directorates and directorates general of health services in the governorates. The Royal Oman Police in Oman has called on citizens and residents to help find a missing citizen in the Wilayat of Ibri. A statement issued online by ROP said, the Royal Oman Police, represented by the Directorate of Public Relations, would like to announce that 53-year-old Omani citizen Khalifa bin Suleiman Al-Jassasi is missing. He left his residence in the Wilayat of Ibri on 27th March 2021 and hasn't returned till date of this announcement. The statement added that anyone with information on his whereabouts is urged to contact ROP's Operations Center on 9999 or the nearest police station. This was all from our local desk for the day. It's time for us to take a quick commercial break, but stay tuned as we have more updates coming your way from our international desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
It's about time we kicked COVID-19 out of our lives. Join us on TTV Outline every Monday and let us learn how to fight COVID together. Welcome back to TTV. You're watching Midday Update. And now from our international desk. The UK government will not be sharing surplus COVID-19 vaccines with other countries until all its adult population have been offered the jab, Prime Minister Boris Johnson's spokesperson said on Monday, playing down recent media reports that the United Kingdom would be offering Ireland 3.7 million vaccine doses soon. Our first priority is to protect the British public. The vaccine rollout is continuing to that end. We don't currently have a surplus of vaccines, but we will consider how they are best allocated as they become available, the spokesperson told reporters during a press briefing at number 10 Downing Street. The official reaffirmed that the government's plan is to ensure that all people over 50 years of age in the UK are offered first their dose by April 15 and to all adults above 18, accounting for 52.7 million of the country's 66.7 million population by the end of July. According to official figures, as for Sunday, 30.1 million people, which is about 57% of all adults, had received at least one dose of either the Pfizer-BioNTech or AstraZeneca-Oxford vaccines since the immunization campaign started in December 2020, and a total of 3.5 million of them have been given their second dose. The UK has ordered over 400 million vaccine doses, and charity organizations such as Save the Children and the Wellcome Trust have been urging the government to start donating its vaccine surplus to poorer countries. Morocco is suspending its flights to France and Spain due to the surge in coronavirus cases, the kingdom's government said in a statement on Monday. The North African country also extended the curfew and other restrictive measures by 2 weeks. According to the government, the decision was made in accordance with the Scientific and Technical Committee's recommendations and will enter into force on Tuesday, which is today. The ban on flights will remain in place until further notice. The curfew from 9 p.m. to 6 a.m. was introduced on December 23, 2020. Besides, authorities have banned celebrations, public and private gatherings, ordered closures of public facilities, including restaurants, cafes, shopping malls, and non-essential stores from 8 p.m. local time. Morocco launched a national coronavirus vaccination campaign on January 28 after receiving the first batch of 2 million doses of the UK AstraZeneca vaccine, as well as 500,000 doses of China's Sinopharm vaccine. The North African country has so far registered over 494,000 cases of COVID-19, altogether with 8,807 deaths. And now lastly from our sports desk. Oman Sail is all set to host sailing competitions for qualifying to the Olympic Games 2021 in Tokyo under the name of Al Musanna Opal Sail Championship from April 1st to April 4th. The Olympic qualifiers will be organized for the first time in the Sultanate with the participation of the national sailing team with the purpose to qualify for the Olympic Games scheduled in Japan. Following the postponement of the qualifiers several times due to COVID-19 pandemic, the International Sailing Federation has chosen the Sultanate to host the event pursuant to the international standards the Sultanate enjoys in terms of regulating the event, besides the expertise Oman Sail acquired in hosting the GCC and international marine events during the past years. The event would see the participation of 100 sailors from 16 Asian and African countries. With this news, we have come to the end of the episode for today, but stay tuned as we'll be back tomorrow at 2 p.m. with more updates and latest news your way. Keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.